Xi Chen is now joining us from New Haven, Connecticut. He is an associate professor of health policy and economics at Yale University. Thanks a lot for being here.
Glad to join you.
A number of years ago, I went to a senior center in Beijing to basically kind of see firsthand what we've been talking about. To me, it was amazing. There were all kinds of activities from calligraphy to watercolors, and people were incredibly engaged there. Is that the kind of thing that you think can really help people who could be stepping into that fringe that leads to Alzheimer's?
Yes, China has already have more than 15 million individuals with dementia. That means 6% of those who are above age 60 already have this disease. And this number will be increasing not only for the prevalence, also for the incidence and mobility and mortality. So it really needs a health in all policy that involve all the parties in the society to help people manage this disease. Something like the community engagement and also early prevention, early diagnosis, early screening is very important. So this may be like involving in people at risk, not only people who are already in the illness.
Yeah, one thing I really was glad our reporter talked about is this can and usually is more difficult on the family. But China is a society, like many Asian societies, that very much respects and cares about the elderly. To what degree do you think that is playing a role in providing care and especially attention right now when needed for those in need?
Yeah, I think family will play a big role in terms of promoting the awareness of the disease. Usually, family members are earlier in identifying this disease for their family members compared to the doctors. Doctors usually come later, especially there's a large underdiagnosis of this disease. And after diagnosis, people are confirmed this disease. Family support, social engagement is still very important, trying to avoid the isolation. Isolation will make the progression of the disease much more accelerated, which is very bad.
Yeah.
So although family also faced with a lot of issues, for example, the lower fertility rate, fewer children will give less help to the older adults as we move on to a society with lower fertility rate.
Yeah, I'm glad you pointed out that isolation. Now, despite the fact that there is so much attention, quite often patients really don't show early signs of Alzheimer's. Now, that has to adversely affect treatment. Many families, in many cases, can simply be in denial, hoping, well, mom or dad may just be having a tough moment.
Yes, I think you're absolutely right. There's a very long preclinical stage of this disease. Usually it can take more than 10 years, people without any symptoms. But people start to have trouble with memory, with managing their assets. So we see a lot of decision-making issue, people losing their assets and people suffering from fraud. So this all need to involvement of family members, community, and even financial sector, because the older adults are also purchasing things, and if there's abnormal purchasing behavior ongoing, so the financial sector may be able to capture that. So it involves like health in all policy to engage in all parties. But I would say that still the bottleneck is early detection, early diagnosis, which need to require enhanced primary care system to identify this disease in the earliest stage. And also the insurance coverage, very important. In the last 5 years, China has been piloting the long-term care insurance. But basically, so far, most of the cities are covering the physical disability, but not the dementia. That's a big issue. And even for health insurance, which cover the drugs, it really depends on where the older adults are living in. If they live in Shanghai, they can reimburse those more innovative drugs. But in Western China, so the reimbursement is lower.